Lymphedema is a chronic condition that unfortunately doesn't have a cure right now. However, it can be well managed with different kinds of treatments. It's always best to work with a certified lymphedema therapist for initial treatment, but then continuing on with self-cares and self-management is really critical to help avoid progression of the swelling, of fibrosis, and overall lymphatic health and skin health. My name is Kelly. I am a physical therapist as well as a certified lymphedema therapist. And today in this video, I'm going to share different self-care tools that someone can do to help manage their lymphedema long term. I'm also going to share and walk someone through step by step on how to create a self-care guide or self-care treatment plan to help manage your lymphedema. I'm also going to share where you can find free resources and guides to help with this. Before we begin though, make sure that you subscribe down below, and you can also follow along with us on Instagram for more related content or check out our website for more resources. But let's get started. When someone goes through lymphedema treatment with a certified lymphedema therapist, we call this complete decongestive therapy. It's made up of a couple different components. We'll do compression bandaging, where we'll use short stretch bandages like this one, along with other foams and paddings. We'll do lymphatic drainage or manual lymphatic drainage, and exercises, and we'll also do skin care. This process usually takes between 2 and 8 weeks. And when we can get someone's size or swelling, or what we call as volumes, as small as we possibly can get them, as well as we can get the skin as supple and as healthy as possible, then we'll transition into a self-management routine that someone will do long-term to help manage their swelling and their lymphedema. Of course, most people will come back and see their lymphedema therapist on occasion for checkups, maybe once a year to check on their skin, or as needed for any flare-ups. This also will vary depending on someone's severity of their lymphedema. Sometimes they'll need a lymphedema therapist more frequently. However, when someone has a really good self-management or self-care routine, they're not going to need their lymphedema therapist as frequently. Your therapist will help create an individualized self-care or self-management routine that you can continue with long-term. But many in the lymphedema community will also tell you that it's really important to do self-advocating and self-exploring to find what tools work best, not only to keep your lymphedema at bay and well managed, but what also works with your personal lifestyle, your schedule, and also what just makes you feel your best. So first, what are some lymphedema self-care tools? Well, the options on the list is pretty long, but I like to think of it as a toolbox, and you have different tools in your toolbox for different pieces of your self-care. You don't need to use and pull out every tool every single day and use them, but you must know what's in the toolbox, what tools you have access to, and how to utilize them for your management of your lymphedema. Some of the most common tools that will be in everyone's lymphedema toolbox are things like compression garments, self-lymphatic drainage, exercises or exercise routines, skincare, lotions or moisturizers. And I have a lot of other videos that I go more in depth on all of these topics that you can check out for more guidance, and I try to put them together in a playlist that I'll put up above here. Some other topics or other tools that are maybe not as common but still well known to work well for lymphedema are things like staying hydrated, using a rebounder for exercise, pneumatic or compression pumps, kinesio tape, eating healthy, and more. I have compiled a list that I have put in a free resources that we're going to talk about in a little bit of a lot of different kinds of tools that someone can learn more about. So where do you start and figure out what tools work best for you and your lymphedema? How do you find and create a self-care plan that is best for you? Well, I've created the Lymphedema Self-Care and Treatment Guide, and yes, it's completely free, and it's a digital guide that you can download and print out from my website, and I'll put a direct link for it down below. I designed it with different worksheets and handouts for someone to figure out what tools are best for them, but also to help assess what is working and what isn't. I use my personal clinical expertise and knowledge, and I try to format it in a way to help someone walk through those steps in the same way that I would help my patients walk through and figure out their own personalized self-care treatment plan. But like I said, it's completely free, and I put a link down in the description box below that you can download this. But let's talk more about this and how it works. An ideal lymphedema self-care program consists of a morning routine and an evening routine. Now, this can be incredibly time-consuming, and spending hours a day is just not always realistic, and it can leave someone really frustrated and burnt out. So instead of picking 5 or 6 tools from the toolbox, try starting with 1 or 2, something small and simple. Then you can try adding them into your daily routine or weekly routine, and then reassess in about 3 to 4 weeks to see if it really is having an effect on your lymphedema. I do have worksheets in the guide to help work you through this. And then you can look and see if this tool is actually working for you, if you need to stop and try another one. Now, this process can take weeks, months, or even years, but once you find the best tools for you, then you have a really good, solid self-care management program. We all have to start somewhere, so this really just gives someone guidance in figuring out where they're starting from to know which direction they want to go next. And then next in the guide is going to really help you figure out what your priorities are, so which direction you want to go, and what are the barriers that are currently stopping you from achieving that plan or those goals. I know there are a lot of different factors that play a role in figuring out what works and what doesn't, and what your priorities are and what the barriers are, and it can get really overwhelming. So the goal of the handout is really to sit down, write out, and really paint a picture of what's going on so that we know what is realistic and what the next steps are. So once you have that foundation set and you have that painted picture for yourself of where things are at, then we can go ahead and add those 1 or 2 tools that we talked about before into your program, into your routine, and then monitor over time how they're working. So I have a handout in the guide that you can write out your current plan, what tools you're going to do in the morning, in the evening, and long term, and just note that. But from there, then what's most important? We want to track and see that if they're working for you. And so like I said, if you're picking a couple tools for the first time, we really want to give them at least 3 to 4 weeks to see if there are any changes, sometimes more. But we want to see, is it helping your lymphedema? Do you feel better? And so we want to write that down so you can see what is valuable for your self-care plan. And so I have another sheet that is your activity log that you can really track all of these tools and how you're feeling and how it may or may not be helping your lymphedema or your symptoms. And so you'll track on here, and it will say what skin changes you might have, what's changing with your swelling. Write down any lymphedema changes, positive or negative. You can write down how you felt. Maybe you had less pain. Maybe you had more energy. Maybe it didn't make any difference. Write that down. And at the end, you'll write down what was the value of it. Did you see a lot of benefit from this tool? Write down high. Was it okay? You maybe saw some changes, but it wasn't dramatic. Maybe it's moderate. Maybe you really didn't see any changes at all, or maybe even unfortunately got worse. Then it would be low or poor. And so that you can write that down, go through each tool, and then you have this all written so that you can go and look back and focus now on what tools are most helpful and beneficial for you and your individual needs. And so then you can take out the low ones, the ones that are poor, and you can really just push them out of your toolbox because they're not beneficial to you. Focus most of your energy or time on the ones that are of high value or of high benefit. And then maybe if you have extra time and you want to do a little bit more self-care, then you can put in the ones that are more moderate or moderately helpful. And so again, they're just tools and handouts to help walk you through to figure out what is best and what is a best self-care plan for you and your individual needs. But then always remember, it is still really important to work with your certified lymphedema therapist so they can help look at your skin and see if they see any changes. They can do volume measurements and we can watch what the volumes are doing, maybe how your fibrosis is, and you can really work together as a team to help guide you on what tools you might want to try next for your self-care plan. And like I said, this is a process. It will be for everyone, and everyone's lymphedema changes over time for various reasons. So this might be an ongoing thing. But this guide is really just something that I created to help you work through and figure out and paint that picture to find what tools work best for you as an individual. Again, you can find the link to this free guide in the description box down below, or you can also go on my website at cancerrehabpt.com and you can find it on there as well. If you have any other tools that have really worked well for you that you want to share with the community and the group, be sure to comment those down below so someone can add them to their toolbox or check them out with their certified lymphedema therapist. But other than that, I hope you all found this video helpful, and I hope the guide works well for you. And we'll see you all in the next video. Thanks, everyone.